Everyone. I'm Dr. Lisa Palmer and Dr. Mama Bear. Good to see everyone coming to you live from Central Florida. So let me know if you guys can hear me. We were just baking in Boise. I guess I could have done bees tonight. Baking in Boise, Idaho. It was my first time being in Boise. First time attending a Cellcore seminar in Boise. Hi, Ethan. So let me know if you guys can hear me okay. I know I'm jumping on a little bit later. I apologize. I was getting some food in me. Hi, Tanya. Hi, Amanda. And so tonight, hi, Suzette. Hey, all these cool people jumping on. And so tonight's topic is parasites, poop, and Cellcore presentations. So glad that you guys can hear me loud and clear. That's awesome. So Instagram is going. Hi, Amanda. All the other channels. So we're live on Facebook. We'll see if we're live on Facebook. Hi, Yolanda. Facebook put me in Facebook jail this weekend because I was posting pictures from a very awesome presentation, a scary presentation, a disturbing presentation. Probably the first presentation that I cried through the majority of the presentation and felt like a weirdo. And so this doc was presenting, he's an immunologist. The doc was presenting on the effects of the experiment. We'll call it that. I'm trying not to go back to Facebook jail, not because I care, but just because it is a good way of communicating and educating, right? And I know a lot of you guys join me on that. And so anyways, it was upsetting. So I'll talk more about that when we get to the Cellcore presentation part. But let me tell you, a lot of the presentations had to do with parasites. And it is still, in my opinion, the most frequently misdiagnosed, underdiagnosed condition in humans. And you know what? And in animals too, because animals get parasites too. That's why you give your dog the one time a month heartworm pill. And those dog owners, go look at the package, see what that's made out of. It's made out of ivermectin. Ivermectin is an antiparasitic. Ivermectin kills parasites. Ivermectin was prescribed by medical doctors that are awake to handle certain conditions, right? And so these parasites are about to ramp up and have their little party. That on Friday, it's either Friday or Saturday. I don't know. I guess I could look up in the calendar, but Friday or Saturday is a new moon, and there's two lunar cycles that they seem to really like. It's new moons and full moons, and then super moons are just like crazy extra. Why moons? Because moons, the moon, our moon, seems to have some kind of effect on our planet. And so we know that the tides, water levels will change, whether the tide rises or falls at a certain point. And parasites are made out of a lot of fluid or water, right? So if it has an effect on our tides, if the moon has an effect on tides, it also can affect other creatures. You ask any ER nurse or doctor, they'll tell you that the crazy people come out during full moons. And parasites can actually get in the brain. So some of the Cellcore presentations were talking about the different places that parasites go and how to get rid of them. And there are parasites that get in the brain and form lesions. So if you know someone who has lesions that were seen at a CT scan or an MRI of the brain or MR of the brain, those lesions are in the brain for a reason. I had a case of a professional athlete had lesions in the brain, and just was told, too bad, that's what you have to live with. And then we found there was parasitic activity, gave her specific supplementation to rebalance the body, handle the parasites, and the lesions are gone. Lesions are gone. And that story repeats itself, whether it's the brain or the lungs or the liver or the kidneys or the spleen or the intestines or the heart. I mean, if you don't believe me, it's totally fine. Go to Animal Planet, go to the Monsters Within Me show, and watch some of the tape, and it will show you parasites. They'll show you surgeons pulling parasites out of people's brains. They'll show you surgeons pulling parasites out of hearts. So my question is, if dogs can get heartworm, what stops humans from getting heartworm? If veterinarians, one of the first things veterinarians do with a litter of puppies is deworm them, how come we don't get dewormed? And where are these little puppies that haven't even been outside yet? Where are they getting parasites from? Well, the answer is mama. Hi, Mia. Hi, Amanda. And so parasites are real, really real, and really cause issues. If you think of a undiagnosed, or if you think of a symptom that you have been to traditional medicine and they have not figured out the cause, it can be from parasites. So Debbie's asking about our full moon protocol. So if you go to bravetv.com and you look up our protocols, we have a protocol, a full moon protocol. So you can do that full moon protocol on new moons, and you can do it on full moons. So yeah, Debbie, I don't know your health history. If you want more personalized information, we are happy to help you at Palmer Natural Health. And give you a personalized program as far as, do you start it now? How much do you take, and all that stuff. So if you're doing the full moon protocol, you can totally start it now. You can start it closer to the new moon, and definitely can start it repeated at the full moon. And some people think, oh, I did one full moon challenge. I did one full moon protocol and I'm good. No, 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 no. You've been accumulating bugs your whole life. Where did they come from? Well, remember that really disgusting thing that you cleaned out? You inhaled them. Or remember that year you were water skiing on the lake or wakeboarding on the lake, and all this water flew into your nose and you were like, you could have got parasites or amoebas from the lake. They can swim in your nose, they can swim in your eyes, they can swim in your ears. You can eat them in food like sushi, raw meats, salads. Sorry, vegetarians, you can get them too from your vegetables. They can swim in pools. Chlorine does not kill them. They can swim into any kind of hole. You can sit on the ground. They can crawl up your butt. You can get them from your cats. You can get them from your dogs. You can get them from your horses. They are very, 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 very common. And luckily, after almost 2 decades of handling them, we are very good at identifying if there's a possible parasitic problem, and then handling it with the most efficient, effective products I've ever seen. And those efficient, effective products are products like this, which is Pair 2 from Cellcore. And actually, I'm going to have a Pair 2 because why not, right? I'm going to have Pair 2. I just like to suck on this stuff. So this is Vendanga, Neem, Triphala, Hilarinia, Amia, Clove, and then it has the carbon technology, which separates Cellcore from a lot of other products. So this is a physician grade line. Why do I care about that? Well, one, I'm a physician and I want to give really good products to my patients. I want to make sure that when I'm buying the supplement to give to patients for them to purchase, I want to make sure the quality is there. I want to make sure that what's really in the herbs that are in here are of high quality. This company checks for heavy metals. This company checks for toxins. And I can safely give this to my patients without worrying about anything else, right? So I love Pair 2. I've got Pair 2 in my mouth right now because parasites can get into your sinuses and cause congestion. They can get into your eyes. So those of you that see floaters, so I kind of go like top of the head down. They get in your eyes, and you can see them, right? If you see a floater, it could be a parasite. Get in your sinuses. So those of you with chronic sinus issues could have parasites in there. Can irritate your thyroid. So if you have an autoimmune thyroid condition, you would not ball up your fists and punch yourself in the face, right? There's something attacking the thyroid. Sometimes when the thyroid's irritated, it'll grow a cyst. It doesn't grow a cyst as like an ornament or a decoration. It grows a cyst because it's being irritated with. Could be parasites in the thyroid. I was just teaching in the Quantum Nutrition Academy, and one of the practitioners was talking about a patient she has that feels a parasite. Sorry, guys, this is gross. Feels a parasite crawl into her throat at night and like chokes her. Like that's gross, right? But parasites can come out the mouth. They come out the rear end. So if you have kids and they're wanting to scratch their butt, they may have parasites. If you have a dog that does like the carpet scoot move on their butt on the carpet, they probably have parasites. Or they're licking their butt a lot, probably have parasites. It can get into lung fields. So some of you with chronic coughs, there's lung flukes that like to live in the lung. And there's actually a cycle where you may have had seafood that was not fully cooked. That fish might have eaten a contaminated snail. The snail had a type of parasite in it. The eggs, the eggs of the parasite are consumed in the fish. When the fish eats it, you eat the fish, you get the parasite, right? Or you eat the bacon that wasn't cooked fully, you get the parasite. You eat the amazing steak that's not fully cooked, you get the parasite. You eat the sushi and it's not cooked because sushi's not cooked. I mean, there is some cooked sushi, but you eat the uncooked sushi, the stuff I used to like, and you guys can let me know, do you like sushi? You get the parasite. Moving further down the body, there could be masses in breasts. Your nipple has holes. That's how milk comes out. But if milk comes out, other things can go in. So, sorry, guys, I'm just going to come down the body. And if it freaks you out, I apologize, but it's true. Parasites can get in the breast tissue and they can coagulate and they can look like a mass in the breast. And so I was just talking to, again, the practitioners in the academy, and they were talking about a breast cancer case. And, this patient's going through chemo and the patient's going through radiation. But in some cases, it could be parasitic related. And so, what if you handled the parasites? What would happen to the changes in breast tissue? When my daughter was little, I was breastfeeding her and I got diagnosed. Well, it felt like I had mastitis, itis inflammation, mast being breast tissue. And it hurt like hell. It was not fun. It hurt really bad. I did not feel good at all. And so my husband, doing the nutrition work we did, tested me, found I had a parasite in my breast, which I thought was one of the most disgusting things that you can find. Gave me the correct supplementation and balanced out the body. The mastitis symptoms went away. And I'd like to think the parasite's all gone. I'm just going to keep telling myself that. And here we are now, right? So parasites can get into breast tissue. Parasites can get into your heart, like heartworm. Parasites can get in the spleen, in the pancreas. Parasites in the pancreas may lead to irregular blood sugar levels, high blood sugar, low blood sugar. If you get hangry, you might have parasites in your pancreas. If you have high blood sugar, you might have parasites in your pancreas. If you have high blood pressure, if you think of a hose, if you step on a hose, what happens to the pressure in the hose? Does it go up or does it go down? Well, it actually depends on what side of the hose you're on, right? Like if you're on the side where the water is building up, the pressure is going to go up. But if you're on the side where you're trickling out water, it's going to go down because there's a blockage there, your foot. Parasites can get in blood vessels. So I work with a patient today that had some swelling in their legs, and with the quantum nutrition testing that we do, determined that there was an immune challenge that could be parasitic in the blood vessels in the leg, causing swelling. Elephantitis can be from parasites in the lower extremities or legs, causing swelling, right? So yeah, parasites are real. So going down the organs, they can be in all of the intestines. They can be in your large intestine. They can be in your small intestine. Women that have super bad periods, they can be affecting, causing cysts on the ovaries. They can be causing fibroids in the uterus. They can be in your vagina. Sorry, they can be in your vagina. I had a case, and the woman told me that she felt like her vagina was being bitten. And I'm like, oh my gosh, that's horrible. And to the point where she would apply essential oils topically to the area, because she said the burning of the oils, and I don't recommend this, the burning of the oils was less irritating than the biting of the parasites. That is horrendous. Like that is just like torture, right? And can you imagine if she went to a medical professional and she said, hey, I think bugs are biting my vagina? They might think she's crazy and put her in the psych ward, right? But she was absolutely right. She had parasites in bothering her vagina. And as we gave her the correct supplementation to rebalance her body, she saw them exit, right? Can you imagine having parasites exit the vagina? Crazy. Men, you're not out of the loop either. You can get testicle parasites. I have had cases where men have masses in their testicle. One, I failed on that case. I had a man who came to me. He had already had one testicle removed because he had a mass in his testicle. The surgeon did not test the testicle to see what the mass was. They assumed it was cancer. They removed the man's testicle. Not okay. And then he came to the office because he wanted to preserve his other testicle. Because, like, yeah. So then I tested him, and I was about to deliver his report on the next visit. And he said, Dr. Palmer, I don't think I could be your patient. And I said, well, why is that? And he goes, well, I hired you because, and by the way, you hire your physician, whether you pay them cash or you use your insurance. If you don't like your doctor, if you don't like me, you can fire me. If you don't like your doctor and you don't agree with your doctor, you can fire your doctor. Some people don't realize that. So he comes to me, and this is super sad. He told me, he's like, well, the surgeon said that there's a possibility that I get testicular cancer in the other testicle. And so he said the responsible thing to do would be to remove the other testicle, because now I'm a dad and I owe it to my newborn son to stay healthy. I'm like, are you freaking kidding me? Like, did he biopsy the mass? Do you have a mass in the other testicle? Like, what the hell? He's like, well, he said I'd be responsible for my new son if I had them both removed. I'm like, yeah, but then your new son's not going to have any brothers or sisters ever, and you're not going to have any balls. Like, you're not going to have, like, you lost your. I'm sorry, you lost your man card. Not to be a jerk, but like like you're compromised, like like extremely forever sterile compromised. Like, I don't know how that doctor said that to him. I don't know how ethically he came to that conclusion. The first testicle was never tested for cancer. I don't, I mean, there's so many words which are not polite words, and there's so many, I'm speechless. Like, what do you do? So yes, parasites can live in testicles. In other positive cases, we've helped men that had parasites in the testicles evict them, and they're doing very well. Parasites can get in the penis. They can swim in the penis. They can get into muscles. So I had parasites in my leg muscles that were miserable. And when I was killing them, it almost felt like my muscles were being ripped off my leg. It was awful. Parasites in your finger. You can parasites in your finger. I mean, they go anywhere they damn well please. I've seen them in the mouth. I've seen them in the gums. I've seen them in teeth. They go anywhere. And so these are really nasty creatures. They get missed a lot. If you think you have parasites, do not freak out. We can help you. You can call the office. Right now we have a new patient special. It's 126. That includes us getting on the phone with you if you're not local, doing a full 30-minute consult. So asking you questions on your history, your health history, your dental history, your environmental exposure history, your family history, your surgical history, your if you're a female, your any pregnancies. If you're male, your sexual, like if all your man parts are functioning, right? So we get all that data. We take that data. We do what's called quantum nutrition testing. And quantum nutrition testing is a super cool technology that allows us to find the cause of the problem. So some of you guys around here, you are very familiar with it because you've had great wins with quantum nutrition. And this technology enables us to examine the patient in a way that other docs may have missed the cause of the problem. What are we looking for? We're looking for chemicals. We're looking for toxic chemicals like fluoride that's in some people's water supplies, chlorine that's in everybody's water supply. We're looking for chemicals like glyphosate, the chemical found in Roundup that's sprayed on our food, that's sprayed on people's yards. We're looking for toxic metals that could also be in your water supply, could also be in your food. We're looking for mold. If you had a water leak, you probably have mold. We're looking for parasites. We're looking for imbalances in the system. We're looking for the areas that are working well, and we're looking for the areas that are not working well. And if they're not working well, we don't say, let's just chop those out. We're looking for the cause and why they're not working well. And then instead of giving medications, which every single time has a side effect, we're looking for whole food nutrition, herbs, homeopathy, so all natural means, carbon technology to rebalance the body, help the body heal, and do that all naturally. We hold your hand throughout the whole process. If you're not in Florida, we can't physically hold your hand, but we will coach you and help you with holistic practitioner professionals. My team is so amazing. Um, they're I am so impressed with them on the cases and the people that they help. They're rock stars. And we help you and people get better and it's amazing. So then poop. Like what's up with the poop? So when you have parasites, you could be constipated. When you have parasites, you can have diarrhea. When we kill parasites, you might have stinky, disgusting, nasty poop because you know what? Dead parasites don't smell good. You might see them come out your rear end. I've had patients where they go to the bathroom and they feel like a piece of spaghetti is dangling and they pull and it's an inch, it is a foot, it is 3 feet. Dr. Dean had a patient, 5 foot long parasite came out their rear end. Where did all that bug live? Probably in the intestines. Intestines are very, very long. And so, yeah, if you have a friend that suffers from irritable bowel syndrome, where they have alternating diarrhea and constipation, if you have a friend that has ulcerative colitis, where they have blood coming out their rear end or mucus coming out their end, I've had cases so bad where they pass gas and poop comes out. They pass gas and a big mucus thing comes out. They go to the bathroom and they look in the bowl and it's all blood. No bueno. There's a cause to that. Sometimes it's because parasites have been living in the intestines that they picked up eating sushi, eating meat, eating vegetables, walking barefoot, playing with their dogs, whatever. It's super easy to pick them up. And so wherever those parasites go, there will be symptoms associated with it. If you have nightmares, you might have parasites. If you grind your teeth, you might have parasites. If you get bloated after you eat, you might have parasites. If you have nausea, you might have parasites. If you have nasty, stinky farts, you might have parasites. So they cause a lot of symptoms depending on the organs and the glands that they're negatively affecting. And that can affect poop. So then we just returned from Boise, Idaho. We flew out there for a 3-day seminar. I got this big old binder. Big old binder. Here we go. Filled with content. So big thing filled with content. 3 full days of amazing practitioners, from cardiologists to quantum chemists to chiropractors to acupuncturists to fertility specialists to nurses to lymphatic specialists to naturopaths to chemical engineers, all presenting on, I don't know why my camera got blurry. Sorry. That kind of got better. Let's try again. All presenting on their specialty and on cases. And so the information was awesome. You know, myself, Dr. Dean, Sohaila, Mirly, Renee, Kaylee, Christy are all big nerds. We're all big nerds. And we constantly are learning to help you guys. You know, as a chiropractor, I have to do so much continuing education units. And the majority of the seminars that I pay out of my pocket, no one pays me to go to this stuff. The majority of the seminars that I attend, one year I spent $100,000. 1 year, just 1 year. This is not all the years. 1 year I spent $100,000 on additional education to help patients. If I don't even want to try to calculate the money I've spent over almost the last 20 years on additional education after my 9 years of college to help patients. So we have to do what's called continuing education units, and I need 40 hours every 2 years. And the majority of the courses that I attend, I get no credit for. And I'm attending it to help you guys. I'm attending it to stay cutting edge. I'm attending it to stay on the forefront of the recent developments. And every single time I go and I confront the TSA, I confront the airplane flights, I confront the traveling with a young child, I confront missing time out of the office, I confront sitting for days and days in a seminar, I confront all that stuff. All of that effort is absolutely worth it to be able to help one case that was stuck, and we don't get stuck very often, or one case that could be a little bit more comfortable, or one case where I have a whole different viewpoint, or one case where I was like, oh my gosh, That one piece of data was crucial for me to help this type of condition. Totally worth it. Totally, totally worth it. And then I get to meet cool people like Rebecca. I got to meet Rebecca. That was very cool. Some of you that are old colleagues and friends, I got to re-meet and re-hang out with you guys. I got to make new friends. It was super, super awesome. And I totally appreciate the Cellcore owners. They're both very successful doctors. They do not need to have a supplement company, but the research that they've done, and other docs helping them as well, the research that they have done and the products that they have produced have been game changers for our patient base. In the past, if someone was a Lyme case, I was like, ugh, a Lyme case. Like, ugh, I don't want to have this case, because I knew that the tools that we had were not handling the problem. And what would happen is we would just kind of chase Lyme, and it was not fun. Now with the Cellcore product line, Lyme cases, I don't want to say it like this, but Lyme cases are way easier. We're getting amazing results. We don't run away from Lyme cases anymore. In the past, we'd have patients that had parasitic type symptoms, and the tools that we had were not handling it, not at all. To the point where Dr. Jason and I wanted to actually create a supplement company, not because we wanted another business, because we have enough stuff going on, but because we needed a tool to help patients with their problems. And just when we were looking at formulation of this product, we were introduced to Cellcore by Dr. Darren Schmidt. It's been a game changer. It's been amazing. In fact, it's been such an amazing journey that they invited me to speak next year on the Eco stage in May. So I'm very honored. I'm very excited. There's so many things to present on. I don't know my time. I know a lot of the speakers only got 30 minutes. I'm like, 30 minutes? I talked to you guys for longer than 30 minutes. Like, how am I supposed to take all the data, all the cool cases, all the big wins, all the helpful hints that I teach in the academy? How am I supposed to wrap that all into 30 minutes? Like, where do I even start? Like, that's crazy, right? That's crazy. So, yeah, so great information. I'm going to hang out with you guys for a little bit. So I see there's a question on the parasite supplements for Dr. Dean's full moon protocol. So when you order that product, you get an email, and the email gives you a link to be part of the full moon protocol Telegram page. Sometimes those emails go to junk mail because of the setup on how things are. So check your junk mail. If not, you can email Nicolette at bravetv.com, and she'd be happy to give you the protocol and help you out with that. Celeste says, I can breathe through my nose all day with my mouth shut. At night, I lay down and I cannot breathe through my nose with my mouth shut. Is it parasites? So Celeste, yeah, it totally could be parasites. Parasites like to move at night. For some reason, they like to come towards the head in some cases. Oh, you can't hear me? Okay. So I don't know why you can't hear me. So let me know, everybody else, if you can hear me or not. You guys should hear me. My mic's been working. And so Robin, let me know if you can hear me. So then, if you were to work with us in the office, there's a personalized plan. Okay. Thanks, Amanda. Thank you, Celeste. There's a personalized plan. Thank you, Suzette. Thank you, Kaylee. Personalized plan to figure out what the heck is in your sinuses. There's a device called a Navage, 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 and it has two little things for each nostril. You want to use a good quality water. You don't want to shoot more junk up your nose like parasites and chemicals and metals. So you want to use distilled water or very, very well filtered water. And it's going to shoot water into your sinus cavities, and then it's going to pull it out the other side, and it gets in the reservoir tank. And so the doctor in me is like, that's so cool. And in one of the presentations, we got to see all these little floaty parasites. But the person in me, the non-doctor brain part of me, I'm like, that is really disgusting. That is really, really yucky seeing that. So then if you're working with us, we can actually test to see what kind of liquids need to go in the Navage to help kill off the funk in the sinuses. There's another device that kind of looks like a little mini sinus pressure washer. And that also has a tank, and you can put drops of Para 3 or Isbard or Isbor. Those are all liquid formulas, we can actually test to see what dose to put in that, and then you can put that in your sinuses. So if your sinuses are getting clogged at night, there's absolutely a cause. We had a patient where there was a mold on their headboard. Then of course they were getting congested and had a lot of other issues because they were sleeping with mold all night, which is not healthy. So that is a possibility. There's ways of testing for mold as well. Okay, cool. All right, so thank you guys that you're saying that you can hear me. If you have questions, drop a line. Someone was asking, can I help with acne? Yeah, I can totally help with acne. So acne can come from a couple different reasons. One reason is the person is not going to the bathroom well. They are toxic. If you have fecal matter backing up into your intestines, the purpose of your intestines is to absorb water and nutrients. In the small intestines, it's more nutrients, and the large colon, it's more water. If you're constipated and the feces are backing up, which a lot of the American population is very constipated, then you're reabsorbing toxins. Your skin will then try to help detoxify and push toxicity out of it, forming pimples. If they could be hormonal pimples. So we look at why are the hormones imbalanced. We do not give hormones to balance because synthetic hormones will never balance hormones. They will always come at a price. And sometimes the price is cancer and infertility. And or it could be parasites in the skin. So those are the three top common. So not pooping well, hormonal issues, and then there's actually a problem in the skin itself. So we look for all that stuff. Question on head sweating. What could be the root cause and how to stop? Well, you're supposed to sweat. So if you do not sweat, you are toxic and you need our help to detoxify your toxins. Wow, that's quite the sentence right there. I don't think my English teacher would like that. To detoxify the toxins. She'd probably tell me to use a different word, right? Clean up the toxins. I guess maybe that's better wording. I don't know. If just your head is sweating, you may have issues with your thyroid. Your thyroid is your thermostat. Your thyroid is what should help your body so you don't feel too hot or you don't feel too cold. Now, I can't tell from your picture because you're on Instagram and that device that's recording me on Instagram is kind of far away. So if you are female and you're getting night sweats, then we can help you figure out why you're getting night sweats. If you are male and you're having the head sweating, I would guess thyroid, adrenals, maybe cardiovascular, but we would do the quantum testing and we figure out what's going on there and we have to handle it. I've had patients where they get hot flashes, female patients, they get hot flashes so bad, they sweat through their whole entire clothes. They sweat through their pajamas. Some people that have Lyme will sweat at night because the body's trying to raise the temperature to kill the bug. Kiana is asking poison ivy suggestions. So poison ivy, I would want to make sure it's poison ivy. And then there's binders like biotoxin binder that may help to bind up some of the chemical toxicities that you're reacting to in poison ivy. So that would be what I would do. I would look to see if there's something else going on with that. So hormonal issues, are we not supposed to supplement with things like progesterone? So Julie, if someone has imbalanced hormones, there is always a cause. Always a cause. Is it coming from a part of the brain called the hypothalamus, right? Is it coming from the gland in the brain called the pituitary gland? Is it coming from the gland in the neck called the thyroid gland? If you're female, is it coming from the ovaries, or maybe you don't have ovaries? If you're male, is it coming from the testicles? If you are stressed, which I don't know anybody who's not stressed these days, it could be coming from imbalances in the adrenals, right? So those are all the glands that can negatively affect estrogen levels, progesterone levels, and testosterone levels. If you are a guy and you take steroids and you take synthetic testosterone, do you know what happens to the testicles? So this is one of the ways of telling if a guy's on roids, if a guy is supplementing with steroids. I don't even want to use the word supplementing because it's not even a good word. Cheating, maybe better words. Cheating with steroids. Their testicles will atrophy. In other words, their balls will shrink. Why? Because they don't need to work as hard because they're putting testosterone in the body. Women, we make estrogen, we make progesterone, we make testosterone. If you are having issues with hormones, you need to find the cause. Is it because you're living in mold and that's imbalancing your hormones? Is it because you have lesions on your thyroid from parasitic activity? Is it because, don't get mad at me, is it because you dye your hair and you're putting a lightening agent on your hair, which will destroy your thyroid? Again, don't shoot the messenger. Is it because you spend too much time in the nail salon in a toxic environment and that is bothering you? So we as women, we can't just close our eyes and pretend that some of the things we like to do have no negative effect. Hey, I used to highlight my hair. My hair used to be a lot blonder than this. This is all natural. My husband said he liked my hair today. Isn't that sweet? And so, I used to highlight my hair, I used to pay $200 to get my hair highlighted. And the next day I didn't feel good, so I did it to look good. But then the next day I looked like crap. My eyelids would be, and you guys can let me know if this happened to you. My eyelids would be all puffy. My face would be all swollen. During that time period, I was gaining weight. I was exhausted. So I'm like, wait a second. I pay this hairstylist to do my hair so I look good. But then I'm putting toxic chemicals on my scalp. And oh, by the way, those little tinfoil thingies, they don't keep the chemicals in there, guys. Don't even pretend like that's true. You inhale the chemicals when they put it on there. And oh, by the way, when your scalp, and some of you guys are jumping off because you don't like what I'm saying, and that's okay. When your scalp is burning, you're absorbing toxins. And those toxins will get into your thyroid. They'll get into your endocrine system. They'll get into your fat tissue, and they have a negative effect in the imbalance hormones. So the long answer to your question is we got to find what the imbalance is. You got to find where it's coming from. My biased opinion, the best way to do that is with our quantum nutrition. The best way to find out is to call the office. One of you guys that know our number can post a number for me, and we find out why, and we handle it. All of a sudden, I develop venous disease. Okay, so vein disease, problems in your veins, like varicose veins, or there's something called intermittent claudication, where you're having issues with circulation in your legs. Yeah, interesting case. I think I told you a little bit about this earlier. Is parasites can get in veins. And when they get in veins, your veins are not going to work properly. So your heart pumps fluid, right? Your muscles contract and help with arterial. You're in your arteries, you actually have muscle, and that helps to pump the blood, right? Your venous system has no muscle. Instead, it requires movement from your body. That's why it's very, very important to move your body. If you sit like a lump of coal in your office chair all day and then sit on the couch all night, you're not moving your body very much. And so it's very hard for your veins to function properly. And so your veins need your muscles to contract. And when your muscles contract, the veins will push blood through. Now, if you're having issues with your veins, you could have parasites in there. You could have cardiovascular calcification. Calcification does not occur from cholesterol. Calcification occurs from inflammation of the blood vessels. Why do blood vessels get inflamed? They get inflamed from too much sugar, cookies, candies, ice cream, alcohol, and they get inflamed by fried foods, hydrogenated fats. Irritate and inflame the blood vessels, and then things that get sticky, things get stuck to it. And if there's too much sticking to it, then you're gonna have issues with your arteries, veins. If it's the artery to your heart, you can have a heart attack. If it's the artery to your brain, you can have a stroke. If it's a clot in the lung, you can have a pulmonary embolism, and your lung can collapse. Okay, so problems with the veins, we want to figure out what caused the problem. We want to figure out the best way to rebalance the body and handle it. There is a pretty horrible procedure where And I've had patients do it where the veins are not functioning well. So instead of trying to figure out the cause, they take a device that burns the veins and kills the veins so then the body can make new veins. And the patients that I've seen this have this treatment that I didn't recommend said that they smell burning flesh and they can actually taste it, so that the doctors will give them like peppermints to suck on. Otherwise, their mouth tastes disgusting and they smell their own burning flesh. If that is not the most disgusting thing I've ever heard of, I mean, I've heard disgusting things, but that's pretty gross. All right, cool. All right, guys. Well, I just wanted to come live, share some of the cool new data. Definitely tell you that parasites are real. Malaria is a parasitic disease. Elephantitis is a parasitic disease. Um, um, I mean, there's so many to list, and then there's so many that go unnoticed. So if you are having issues and no one can figure you out, we are extremely good at mystery cases. I'll type the number below. So the office number is 407. They're not there yet now because it's late, but you can leave a message 407 682 8444. You can reach out to us on Facebook, and we'd be happy to figure out what the heck is going on with you, because you are not crazy. It could be in your head, but not in a crazy way. And we can help you. I'm Dr. Lisa Palmer, Dr. Mama Bear. Thank you guys so much. Have a great night. Good night.